I'm focusing on my cystic fibrosis fact sheet, the early childhood practice brief, as well as the resource list. Throughout the semester, I've heavily focused on cystic fibrosis and have done a variety of projects in order to gain more knowledge and learn about the signs and symptoms of the disease. Throughout, those affected by cystic fibrosis live in a constant battle, and there is no definitive cure to this day. Cystic fibrosis has often been said that when you have cystic fibrosis, breathing is your number one focus. Cystic fibrosis causes mucus to occur and build up in the lungs and makes it so hard for those who have it to breathe. It can make anything from going up a flight of stairs to just getting up off your couch an unbearable task, one that we do not know in our day-to-day lives. When understanding the general description of cystic fibrosis, one can understand that it is a genetic disorder that causes difficulty breathing and digesting food. Affecting 30,000 children and 70,000 people worldwide, cystic fibrosis is a serious disease. Also known as musculoskeletal, cystic fibrosis affects many organs, such as the lungs, pancreas, upper airways, liver, intestine, and reproductive organs. Cystic fibrosis is caused by a gene mutation causing mucus to become thick and sticky. Cystic fibrosis is found by an elevated chlorine concentration in sweat. Males account for 50% of all cases of cystic fibrosis, but often have better outcomes than females. The reasoning for this is because men have just responded better to the treatments that have been implemented on those with cystic fibrosis and have also shown to live longer than females. Cystic fibrosis is the most common life-shortening multi-system disease with an autosomal recessive inheritance pattern today. Jack Leonard stated this in one of his most recent texts about cystic fibrosis. I feel that this quote shows the severity of cystic fibrosis when he states that it's the most common life-shortening disease. Also, how it is showing an autosomal recessive inheritance pattern. This essentially means that those with cystic fibrosis are able to pass it down genetically and is a genetically modified disease, making it very hard on families and hard on those who have it. When looking at the signs and symptoms of cystic fibrosis, it is different for everybody. Some people don't even really experience any noticeable signs or symptoms and get cystic fibrosis, where others get misdiagnosed or mistreated due to their diagnoses that are incorrect. The most common signs and symptoms are thick mucus in the pancreas, salty tasting skin, a cough that doesn't go away and contains mucus and or blood, wheezing and shortness of breath, frequent lung and sinus infections, constipation, pneumonia and bronchitis, chest infections, poor growth and weight gain even with a big appetite, and nasal polyps. That's a growth in the nasal cavity that is not supposed to be there whatsoever and can be very uncomfortable for the individual who has it. The most common sign and symptom is poor growth and weight gain, even with a big appetite. This is the one that goes unnoticed most frequently and often gets thought to be diabetic issues or eating disorder issues instead of cystic fibrosis, and it's one of the reasons cystic fibrosis can go untreated for so long because it can be misdiagnosed. Those who have cystic fibrosis have problems with their digestive system. So when they eat a lot of food, the mucus absorbs the food faster than it would because there's more mucus. So it causes the body to metabolize it faster, causing it to lose weight. In order to go through the identification process, pulmonologists specialize in the lungs and help people with CF and are the ones who typically diagnose cystic fibrosis. Sweat tests are the most reliable and check for high levels of chloride in sweat. These are commonly done the second that it is thought someone has cystic fibrosis and are also done to babies at birth when it is thought that they might have CF. Blood tests find abnormalities in those with cystic fibrosis, so they can also measure the levels of sweat in the blood in order to know if one does or does not have cystic fibrosis. Most have clinical feature, or you have to have a clinical feature in order to be diagnosed. So you cannot be diagnosed with cystic fibrosis without clinical proof, and that has to be from a sweat test or a salt test. A history of positive neonatal screenings is also a cause for a test. All infants in the U.S. are tested for cystic fibrosis at birth due to its commonality, genetic mutations, and the severity of the disease. When understanding the interventions for children with cystic fibrosis, it's important to remember that all children are different, and that not one intervention is going to work for one individual as it will another. I discussed 2 interventions in this presentation very heavily. However, I want to note that the other interventions for those with cystic fibrosis are childhood immunizations, antibiotics, other medications, bronchial airway drainages, enzymes, insulin shots, oxygen therapy, and lung and/or liver transplants. Lung and liver transplants typically aren't performed unless the patient is in dire need. The first treatment that I'm going to be talking about is immunizations. Immunizations and antibiotics prevent and protect infections and make it easier for the mucus in the lungs to be coughed up, making the mucus thinner. To do this, immunizations are provided for children at a very young age. Immunizations are a form of primary prevention to help limit risk exposure to the disease as well as increasing immunity at the same time. In our current society, the ethics behind vaccinations are heavily debated. However, those with cystic fibrosis are encouraged heavily to get immunizations in order to help with their pain and to thin mucus. As stated in cff.org, we strongly encourage all unvaccinated people with CF to get vaccinated as soon as possible. With the rise of COVID-19 in our country, it is so crucial that those with CF get immunized in order to further prevent the risks of having cystic fibrosis. When you get the cystic fibrosis immunization, it is a pneumococcal immunization that protects pulmonary exacerbations caused by a pathogen. A dose of this vaccine is recommended to be given at 6 weeks, 4 months, 6 months, and 12 months. The first dose should be given at the age of 4, and a follow-up vaccine should be given 5 years later. To receive the vaccine, it must be provided by any VFC program providers, which can be private doctors, private clinics, public healthcare centers, community healthcare centers, schools, and much more. The preferred site for this immunization in infants and young children is the vastus lateralis muscle in the thigh. As children age, it is better that the injection goes into their deltoid muscle for it to be absorbed properly. Those with cystic fibrosis are more at risk to develop vaccine-controlled diseases at any age, so vaccines help to prevent a majority of the health problems before they have a chance to take hold. Immunizations allow individuals not only to receive the disease, but also to learn how to fight it and become immune to it. And in the past years, immunizations have grown substantially with technology, and they're really easy to be accessed. Also, the same vaccine can be given to children aged 4 all the way up to the age of 64. So this vaccine is very wide and can be used for many people, making it super simple and easy to get. The consistency here makes it very accessible, and the side effects are known, but they're not super severe. In recent years, with technology